Mhm.
Okay, welcome all to Washington Women's Foundation Priority 101 series on mental health and housing. My name is Catherine, and I have the pleasure of working here at the Washington Women's Foundation. The Washington Women's Foundation is a strong and inclusive collective of informed women who together impact community transformation through grant making and utilizing trust-based philanthropy. We value and encourage active learning, thoughtfulness, and uplifting the voices of those in our community who are experts and leaders in their fields. Through our collective grants, our members invest in 3 different priority areas each year that have been identified by the broader Washington Women's Foundation community and chosen from the year's themes. Before we get started, I want to take a moment to acknowledge that we are gathered here on a stolen and unceded Indigenous homeland, and in the context of broken treaties and unresolved harms to Native peoples. We are on the traditional land of the first people of Seattle, the Duwamish people, and of the Coast Salish, the Stillaguamish, Duwamish, Muckleshoot, and Suquamish, who have made and continue to make their homes here around the Salish Sea. We recognize as well that we live in a nation of wealth, a wealth created by the subjugation and exploitation of African peoples brought to this land through chattel slavery. We honor and uplift the original Indigenous stewards of this land and the forced contributions from generations of Africans. This is an acknowledgement of stolen land and stolen labor, and a recognition that the impact of these wrongs reverberates into our present day. Our acknowledgement does not replace authentic relationships, but serves only as a first small step in honoring with gratitude the land on which we live. A few words about mental health and housing before we introduce our speakers today. The Washington Women's Foundation defines mental health and housing as the investment in culturally relevant mental health and addiction recovery services for people who lack stable housing, including organizations with counseling staff and those working within a network of external providers, which includes the systemic intersections of housing instability and mental health, including addiction. I am super thrilled to introduce our 4 speakers to you today. These panelists are experts, change makers, and leaders in the mental health and housing field here in Washington and across the country. At the end, we'll have time for engagement and questions from the audience. And as I introduce our panelists, we will spotlight them and bring them up on the Zoom stage. Deborah is an NYU professor of anthropology in the College of Global Public Health. Welcome, Deborah. And we have Anna, who is the Director of Public Policy at the National Alliance on Mental Illness in Washington State. We also have Patience here, who is the Executive Director of the Housing Development Consortium. Welcome, Patience. And I'm not sure we have our 4th panelist here yet. Let me check. Hopefully she joins us soon. I think we will get started with our 3 panelists. We are so grateful that you're here. The first question for 3 of you is share who you are and what brings you to this work. And Patience, I'll start with you.
Thank you, Catherine, and thank you all for the invitation to this table. I mean, there's nothing better than a Wednesday with a room full of strong and informed women. I just love that kind of space. As introduced, I am Patience Mulaba. I serve as the Executive Director of the Housing Development Consortium. And who we are as an organization is we are a membership association with over 200 member organizations that work on affordable housing and homelessness across King County. Our members are broad and diverse, so they include nonprofit affordable housing providers across King County. We have some private business that also provide affordable housing, public funders, general contractors, architects, and increasingly community-based organizations who are all coalescing around the issue of affordable housing and homelessness. We simplify the activities of our organization as this top three. Number one, we focus on advocacy. So we advocate for affordable housing and homelessness solutions. We broker cross-sector partnerships on those two issues, and we also convene the whole sector on critical efforts that can advance effective solutions on affordable housing and homelessness. Our vision is to ensure that all people throughout King County can live in safe, healthy, and affordable homes. And we believe that we get there by building and sustaining a diverse network of housing providers who are really committed to helping people through complex homelessness needs that they have, whether that is substance use disorder, services of mental health that they can get to a point of well-being and really being able to thrive. How I came to this work, I was born and raised in Southern Africa, Zimbabwe, and I had the fortune of being raised by my grandparents, my grandmother and my grandfather. And in all of the work that I watched them do, they showed up for their community. We went through difficult times of countless droughts that I watched them just stand up for their community, even with limited resources themselves. And I've upheld that in the work that I do. And I believe that is the work that we're doing as the Housing Development Consortium. Thank you for having me here.
Thank you so much, Patience. Anna, what about you?
So hi everyone, I'm Anna Nepomuceno. I am the Director of Public Policy for NAMI, that's National Alliance for Mental Illness, the Washington chapter. So the National Alliance for Mental Illness, we are a, we believe that, that we work to help improve the lives of people with mental illness through support groups, educational programs, and advocacy. And this is where my my role comes in, is as Director of Public Policy. I head the advocacy efforts for changes to state laws and funding for mental health programs across the state. So with NAMI, NAMI is divided. It's a multi-tier program. We've got NAMI National, which oversees oversees advocating on a federal level. NAMI Washington and all other state affiliates oversee what happens on a state level. And then we have 20 local affiliates across the state. And these local affiliates serve the needs of their communities. So we've got like NAMI Seattle, NAMI East Side, NAMI Spokane, and sorry, let me start over again. Anyways, in my role right now, it's the legislative session, so I apologize for being a bit frazzled. We just had our annual lobby day on the 19th, where we had over 200 people registered to come to the state capitol to talk to the legislators and advocate for our legislative priorities. And so what brought me to this work is I've had over 10 years of political experience, initially working different local campaigns and state legislative campaigns. And then I got into advocacy work when I was a student at University of Washington, Tacoma, where I served as a student advocate for higher education. And from there, that's when I decided advocacy is what I want to do for the rest of my life. And so I served initially, after I graduated, I served in the state legislature as a legislative assistant for 4.5 years. And then now I started with NAMI roughly about a year and a half ago. And what brought me to NAMI is not only, did I want to advocate for mental health issues, I am also somebody with lived experience. And I feel that my experience as someone who has been dealing with mental health conditions for all my life, could be a good person to advocate and really fuel my passion to help change the system.
Thank you, Anna. We're so glad you're here. And Deborah, we'd love to hear from you.
Okay, thank you so much for inviting me. I'm on the East Coast, so I'm not in the Washington area. I'm a professor in the Silver School of Social Work at NYU. And I have been doing research on homelessness for about 36 years now, which gives you an idea of my advanced age. In New York, it was a real problem when I came to New York for a postdoctoral fellowship in public health in the 80s. And as you may know, I mean, along with the West Coast, New York has a tremendous number, over 60,000 people living in shelters right now, plus over 100,000 migrants coming in. So we're kind of like in the midst of a lot of things going on. And I am an advocate of Housing First, having come to work with Pathways to Housing as a researcher and later on an advocate. But I've done a fair amount of research on Housing First and am a strong proponent of it. And I understand there are people that don't like it so much, but I think we have the research evidence behind it. So that being an advocate, I'm at this stage of my career where I'm much more comfortable being an advocate in some ways than, well, I don't know what else I could be, a teacher and a professor, but anyway, it's good to be here. Thank you.
Thank you all. I'm excited to get started. And our first question is, how do you define the intersection of mental health and housing in your context and work? And anyone can start.
I'm going to start just by saying that I came into it because we were seeing in the late 1980s a tremendous number of people on the street with mental illness. And even though the percent of people with serious mental illness is hovered at around 30% in any of the point in time counts and so forth, obviously the needs of people suffering from serious mental illness come to public attention pretty rapidly. So that is the population that Housing First, Pathways to Housing started working with and successfully housing. So my focus has been on those individuals. They're in a minority, but they're very much in need of services and housing.
I can go next and build on that, Deborah. In our work as the Housing Development Consortium, we view the intersection of mental health and housing as a complex interplay between two fundamental aspects of individual well-being. Number one, it is important to understand that stable housing is not merely a physical necessity. It's not just the four walls around a person, but it's also a cornerstone of mental health, mental stability. So safe, healthy, affordable housing really provides for improved mental well-being across the board. It provides a sense of belonging for people. It provides a sense of security and control over your own environment, and therefore a path for that continued stability and maintenance across the board. But number two, conversely, mental health challenges can pose significant barriers in accessing housing. So once there is untreated mental illness, substance use disorder, chronic stress, all of those compounding effects then affect the ability for a person to have access to stable housing and therefore long-term their mental health. So we look at this work from how can we recognize the importance of the bidirectional relationship between mental health and housing proactively, because when we address one over the other, there's an inherent impact on each of the two key aspects.
I completely agree with everything that Patience says. There definitely is an intersection between housing and mental health. And, you know, at NAMI, we really support the social determinants of health. We want to make sure that people have affordable housing in order to help maintain their mental health. And, you know, one of the issues we see too is when you get into the cycle of where, rent keeps increasing, your housing cost keeps increasing. And it's, if there's any underlying mental health issues that's already there, it's just going to continue to get worse and worse. When you have that anxiety, basically what happens is you're in survival mode 24 hours a day, 7 days a week. You don't know how you're going to get rent, how you're going to pay for your mortgage. You don't know if you're going to be homeless next month. And that's just going to impound and, continue to a downward spiral and degrading with your mental health. And then in turn, people can end up losing their housing if they're experiencing mental illness. They could lose their employment, or just have significant health issues, and then it just spirals from there. And then you have a lot of the stigma related to mental health. People with mental health issues trying to find housing could be even more difficult if landlords find out that they have mental health issues. And again, unfortunately, it's that stigma really makes it even more difficult for people with mental health issues to find that housing. And then when people get to that stage where they are homeless, that's where things even spiral even more out of control. Because again, like I said, any type of underlying mental health issues is going to continue to get worse. If somebody is in treatment before they're homeless, a lot of times when they become homeless, they're unable to continue with that treatment. They're unable to afford their medication, or in some cases, people will have their medication stolen if they're living out on the streets. And it's just this unending cycle that people experience. It's homeless, from homelessness to inpatient care to sometimes in prison. And so with NAMI, we just really we want to support, especially supportive housing for people with serious mental illness, and affordable, safe housing for all people, regardless of whether or not they already have a mental health condition or not.
Wow, this is a knowledgeable group. Thank you for diving into that intersection a little bit more. So next, I wonder if we can set the context on a definition of what we mean when we say affordable housing. How many people in Washington lack affordable housing, and how much housing is required to meet the need over the next 20 years? And then how does this affect homelessness, and how is equity at the center or not of this issue?
Affordable housing, I think at least, is defined as no more than 30% of your income goes to paying the rent. And if you're paying more than 30%, the risk goes up and up and up to where it becomes unaffordable. And that's where Section 8 vouchers and others, other forms of assistance can be activated. And we have thousands of permanent supportive housing beds and units in the city, but it's still not enough. And of course, the lack of affordable housing, the fact that it's been left up to the private sector for decades now, is catching up with us, even more so than back in the 80s. It's worse.
Yeah. And I think the need numbers speak a lot to your point, Deborah. The one piece I'll go back to is that the definition of affordable housing is really determined by the Housing and Urban Development, which is a federal agency. And as Deborah said, if you're paying less than 30% of your income towards housing, and that's mainly based on gross income, then your housing is affordable. But if you're paying anything more than that 30%, that housing is not affordable. When you look at the numbers here locally, whether it's in King County or Washington State, we have a significant number of people who are paying more than a third of their income towards housing. Across Washington State, it is 1 million households who are paying more than a third of their income. In King County, it is 200,000 plus people who are paying more than a third of their income towards housing. And when we look across the board in terms of projections going forward over the next 2 years, we know at the Washington State level, we have to produce 1 million homes just to make sure that people are not paying more than a third of their income. But in order for us to get there, it means we have to produce about 50,000 homes statewide. At the King County level, we have to produce about 9,000 homes, and that's annually. But when you look at how much we're producing, we are merely not close to half of that production level, which means if we don't double down on our policies, if we don't double down on the resources to invest in scaling production, because to the point that Deborah raises, the market on its own cannot produce housing that's affordable for people. You need government intervention, you need subsidy, and we have not scaled all of that to meet the need. In fact, the Puget Sound Regional Council says we are 2 years behind in terms of production and investing in housing. So therefore, we must see much more bolder action in order for us to see the numbers really change in a significant way. The question as to how does this all tie to homelessness? I think Anna said it well. If rents continue to skyrocket for people, they're unable to maintain that stability of the housing. And long term, they're out in the street and affected by homelessness. And once they get into homelessness, it is a very difficult loop to come back to stability. And that's where the work on mental health services proactively to bring people to a path of stability becomes really critical.
I just wanted to add, Patience, you mentioned something about how, market rate housing can't address the entire problem, and you're completely right, because when Catherine, when you pose the question, what is considered affordable housing, I almost feel like what really is considered affordable housing is so disconnected to what the market sees as affordable housing. And so when you have cities that are incentivizing private developers to create affordable housing, what those developers interpret as affordable housing isn't necessarily affordable housing. For example, there are buildings that are being built here in Tacoma, where I live, that are being marketed as affordable housing. Well, how is it affordable? Well, it's $1,200 for a 300 square foot apartment. How is that affordable? Well, it's only $1,200. Yeah, for one person. What about a family of 4? There's no way that a 300 square foot apartment is going to house a family of 4. And so I think that there's that disconnect there of really, what is truly affordable housing and what isn't. And so, yeah, we need to go beyond market rate apartments. We need to go look beyond private industry and creating housing. And as Patience said, really look at, supportive housing and subsidies. I mean, like housing benefits for low-income people, and more social services for people to help them find stable housing. I also wanted to bring up, Deborah mentioned empty beds. That might be a statistic in New York, but here in Washington State, unfortunately, we're pretty well behind when it comes to mental health services. We're actually 39th in our country for mental health services. Wow. So Washington State is way behind New York when it comes to supportive housing for people with mental illness and inpatient beds. We actually have a severe lack of inpatient beds, both for adults and young people across our state.
And I'll build on that and say that capacity continues to reduce. So it's really an area of work across the board. One thing I want to go back to those in terms of housing production, one thing we really encourage is that it's going to take all of us, whether it's market rate housing providers developing the full spectrum of housing so we can take off the pressure from the market, and then it is government being able to subsidize and really invest in low income options for people. It's all of those arms at scale so we can continue to meet the growing need for housing. And then there was a portion of a question that you raised, Catherine, around equity. When you look at who is cost burdened, when we look at that 1 million number and we break it down, really the affordable housing crisis issue or homelessness issue is a racial equity issue. Mm-hmm. People most impacted are Black, Indigenous, people of color, communities across the board. And we see that in the numbers on cost burden. We see that in the numbers of people who are experiencing homelessness as well.
Absolutely.
Yeah. Thank you all. Building on that, within the homelessness, houselessness arena, how can we demystify the experience of people who are unhoused with co-occurring mental health needs?
Are you talking about myths that are out there in the atmosphere about who is homeless or why they're homeless, or?
Yeah, I think maybe less about myths, and more about kind of honoring the experience of people who are unhoused, with lots of different dynamics in their life. Does that make sense, Anna, to you on that question?
Yeah, I mean, when it comes to demystifying, I think I did want to touch on the myth that a lot of people assume that if you have serious mental illness and that you're homeless, that you're going to be a danger to society, and that's not actually the case. In actuality, there's more of a chance for the person with the mental health issue to be harmed and have violent acts on them rather than them being violent towards other people. So I did want to demystify that stigma that goes around when it comes to people with mental health issues. And as far as like the lived experience of people with mental health issues, you've got people from different backgrounds. You have, it's almost when it comes to that debate of whether or not mental health causes homelessness or homelessness causes mental health, it's both. There's no chicken and egg here. It's both. There are people that have, that have downward spirals in their mental health that causes them to be homeless, or there's also people that are in perfectly good mental health when they initially become homeless. And of course, the situation where they're having to they're having to survive every single day is just going to make them spiral into mental illness. And so I guess that's kind of where I see it. I guess I'm not quite understanding the full questions either. So
No, that was spot on. Yeah. Deborah, did you have anything to add?
Yeah, I want to just make it clear that in New York, we're well below the number of units versus need. The supply is way below demand. Again, I'll come back to, in my work and in advocacy, I talk about where is the evidence for this, and there's currently some fairly negative publicity about homeless mentally ill people, as if they're fearsome group, and as Anna said, they're much more likely to be victimized. We have a legal right to shelter here in New York City, and we so far have kept it, but by that right, what has happened is we just build more shelters, and then we have permanent supportive housing. I will say, for people with mental illness, we do have and have had since the 90s mental health dollars actually spent on housing, which is kind of unusual. Because federal, you can't use Medicaid, for example, for housing, although that's starting to break down the barriers there somewhat. But I think back to some of our proven things that work, like assertive community treatment. There's something called critical time intervention for people who are institutionalized but on the verge of being left out there, and helping them bridge into some kind of supportive housing. These things work and help people. It's just a matter of making it available and making what I call the offer. If you want someone to come in off the street in this city, don't offer them a shelter bed, because they will very rationally tell you, no, thank you. The shelters are horrific here. Just saying.
yeah, I think I want to add on to that. When it comes to homeless shelters, first of all, a lot of times they're already in full capacity, and then when you're somebody that has mental health issues, sometimes overcrowding and chaotic background and everything can really be a barrier in entering those facilities and staying there. They just aren't able to handle the chaotic nature and of a homeless shelter, so they'll tend to stay away. Also, some of the feedback that we receive is that when you're a young person, when you're a young adult, 18 to 24, and you're on the streets, people keep telling you, oh, go to a homeless shelter, go to a homeless shelter. A lot of times young people don't feel comfortable going to homeless shelters. It's just not an environment that they feel comfortable going to. And so we really need to look beyond those shelters and go more towards permanent housing for people. I was thinking a little bit more about your question, and because when we talk about homelessness and the debate on how do we mitigate homelessness, there's a lot of talk about, well, we need to increase our mental health services. And yes, that's all well and good. We do need to increase our mental health services, but you can give people as much treatment as they can take. But if they don't have permanent, stable housing, no amount of therapy, no amount of medication is going to lead them to recovery, flat out. They need a permanent home to live. They need stable housing.
And I will just add to that, because I'm really glad you said that. Because I was involved with Pathways to Housing from the very earliest times, and I had to see it to believe it, but I really believe it. I've seen people in tremendous distress. And once they get into housing and they get 24/7 support services, within weeks, I don't even recognize them. They are in such better shape, and they're thinking about the future. They're hoping to reunite with family. And if I hadn't seen so many instances of this, well, I probably believe it anyway, because the data are there. But seeing how it's benefited people and interviewing hundreds of these people, as I have in my research, it's just a real reality that you need a home to begin the process of recovery. And the mortality rates are so high. It's so sad to say that someone who's 50 is considered a very successful aging process on the street, because the life expectancy is very, very low.
Thank you. So I wonder if we can transition to talking about folks who do transition out of behavioral health services or inpatient treatment, who are being released directly into homelessness. Can we discuss this critical step in the process and what is missing?
Isn't that illegal? No?
No.
I
Well,
think it is here. I don't think you're allowed to. You have to have some place, and then hospitals have to keep them until they find a place. But I admit there's probably some neglect of that.
Yeah, Washington State, it is not mandatory for a place to have somewhere to go when they're released from inpatient care. In fact, a lot of people released from inpatient care are being released out onto the streets. They're being told, oh, just go to these shelters and they can get you help. And then they're also presented with shelters and housing situations where there's all these barriers that they just can't meet. And I think, one of the things that really needs to be discussed is low barrier housing supports for people with mental illnesses, because a lot of times those will be barriers for them seeking those services. But yeah, the reality is that, when someone comes out of inpatient care, they don't need to have someone who will say, oh yeah, they can stay with me. They'll get put out on the streets. And unfortunately, what happens is that people get caught in this vicious cycle where they are homeless. They end up getting either arrested or sent to the emergency room, and then sent back to inpatient care, treated, get a little bit of recovery time, then back out on the streets over and over again. And sometimes it cycles to the point where they end up in prison because their mental health becomes worse, and then they might end up doing something that's considered illegal, or in the worst case scenarios, they'll end up dying by suicide. And so right now there's actually, somebody mentioned something about legislation that addresses this particular issue, and there's actually a bill that is still alive and just got passed out of Senate out of a Senate committee. It is House Bill 1929, and it is transitional housing for 18 to 24-year-olds coming out of inpatient care. So I know that this particular legislation is limited to people between ages 18 to 24, but it's a good start. And so what it would do is it would set up a program to create transitional housing. When an 18 to 24-year-old is released from inpatient care, they'll be sent to the transitional housing, and while they're in transitional housing, they'll be set up with more permanent housing solutions, behavioral health treatment or ongoing treatment to help with their recovery, and other wraparound services that they need. And these will be transitional housing specifically for that 18 to 24 demographic. But again, a great start. The feedback we get from some of our members, is they're someone that experienced, being in inpatient care, and then not having anywhere to go. They're, put out in the streets, and while they were able to eventually get housing, that whole time that they were experiencing homelessness was extremely traumatic and contributed to their mental illness getting worse. And so right now we have our state investing in inpatient care for people, helping them towards recovery, but all of that's undone the moment that they're released onto the streets.
Yeah.
I
And
just
it's
want to
all,
Oh, so can I just say one thing and then I'll shut up, I promise. What you just described of being in and out of the hospital, going to jail, is far more expensive.
Yeah.
Than the cost it would take to provide permanent supportive housing. And that's what gets me crazy at night, is this thought that we're spending $3,000 a month for one shelter bed in New York City. You can get a halfway decent apartment still for $3. So, I mean, it's irrational almost that we think the government's involvement in housing is somehow un-American or something. It's just, it goes back to Reagan, but it just makes me a little crazy. Sorry. Go ahead.
yeah, and it's not just the shelter cost, it's the ER cost, it's all of the compounding additional effects that really are costly to us as a public than us investing proactively. But I think at the core of when people are coming out of inpatient support, getting into housing, the bottom line is we just simply have not built enough housing across the board, and we have an affordable housing challenge. But in Washington State, we also have not increased our capacity in terms of shelters. Unlike New York, we just simply do not have the shelter capacity that can house the 53,000 people who are homeless, for example, in King County per night. So they don't have anywhere to go just as an interim gap to a point of then accessing housing across the board. There's another missing piece within the spectrum of housing provision, where we've worked most recently, particularly in King County, on the crisis care centers, where people can walk in, get the support they need, go elsewhere and continue on their path towards stability. So last year we worked in support of the Crisis Care Centers levy, which is a 9-year levy, and it does restore the residential treatment beds in Washington State. It's about 5 centers, so altogether they will produce about 46 beds across the board, which of course is not as significant as we need, but it's an addition to what we've continued to lose across the board. It comes with the comprehensive tools that people need at a point of emergency. And then longer term, there's an investment directly in housing so we can have supportive services that they need to a path of stability. And we've underinvested in supportive services across the board. We do not have one standalone revenue source that we can go to and say, we continue to double down investing in supportive services for housing. We've tried to do that at the state level with House Bill 1406 in 2021, and that's making some change, but it's a small amount of resources than what's needed across the board.
I just wanted to add to the Deborah was mentioning how it's much more expensive for inpatient care as opposed to and emergency rooms as opposed to supportive housing. I'm just looking at some data right now, and it's for the cost for supportive housing is $54 a day as opposed to $1,187 a day for inpatient psychiatric care and $2,152 a day at the emergency room. I just wanted to add those numbers in.
Yeah, thank you, Anna. I think that helps set the scene. Like we hear that statistic a lot, but to see the actual numbers is crucial. So it's always good to talk about the problem, and I wonder if we could also talk about some of the solutions that we're seeing in this work. So this is a two-part question, which is, what are the main barriers to accessing housing for people whose experience is at the nexus of homelessness and mental health? And then what are some of the solutions that we're seeing in this work that are having a positive impact?
All right, we can start locally and talk about just the importance of the housing first concept as an approach. Washington led the way on housing first. We have our providers right here in Washington who launched the work and continue to lead the nation in terms of scaling the production of permanent supportive housing. And not only is it housing that quickly gives people access to a stable home, it also comes with the services, with a harm reduction approach comprehensively, with a trauma-informed approach to really support people to a path of stability. Across the board, we've continued to see the production of new permanent supportive housing. However, we remain with limited resources to produce that kind of housing at scale. And I think I will highlight that in King County, we've had some critical investments in scaling permanent supportive housing options. We have the Health Through Housing program that is run by King County. The revenue source for that is a sales tax credit from the state level. And the money that we get from that really helps us be able to acquire existing buildings and turn those buildings into emergency housing. And long-term, it does become permanent supportive housing. That has meant that we have options of housing across King County that are providing permanent supportive housing opportunities that we otherwise would not have.
We're the opposite here in New York, where Housing First began, in that we have a shelter industry, basically, of hundreds of millions of dollars spent, a lot of jobs and a lot of nonprofits, but it's really hard to change the will to go and, divert any of that income. And I think, you have powerful interests here, real estate boards, land developers, landlords, who aren't necessarily in favor, frankly, of having governments provide housing and support services, which are needed. And so, yeah, I'm obviously a big fan of Housing First. I wrote a book about it. I was just in Brazil. They're going to roll it out there. It's in Western Europe. But I think we're still struggling in this country with the idea of housing somehow being up to the individual. It's some ethos that we don't think about a lot of things in that way, but for housing, it seems like we expect people to be blamed if they don't have it. And to me, it's like musical chairs. It's where you are when the music stops, because there's no way even of predicting among poor households which ones are going to be plummeted into homelessness. So I feel political will is a big part of it. And right now we don't have that in New York City. So I praise you for doing it in Washington, is all I'm saying.
Well, Barbara, Deborah, I might have to take some of that back. I mean, we've continued to build the political will. I think where we're lacking now is community will.
Okay.
We've most recently had a case in the city of Canmore where the city pulled together a project over 18 months, funded at the state level, funded at the federal level, funded by the county, and ready to go. And neighbors show up and they say no.
NIMBY.
And the city votes no on the project. We're fortunate enough to say we have some political leadership that's strong, and Redmond is stepping in to support the project, which is such a remarkable I think stands to see as an approach from leadership. So there's a lot more work to do in terms of building community will.
I wanted to add to that community pushback against supportive housing and mental health services. This is something that NAMI is seeing happen across the state. There was a 16-bed inpatient facility that was proposed up in Stanwood, and the community feedback for it was really heartbreaking. There were town halls after town halls to try to educate people on what this facility was for, but community members were constantly trying to fight against it and finding every way that they can to prevent this from happening. And every time there's some type of supportive housing, homeless shelter, or behavioral health service that's proposed in a community, you get this, what we call NIMBY feedback or NIMBY pushback, where people have this, this perception of what they think homeless people are, and they don't want them in their neighborhood. They don't want them, they think they're a danger to their children, they're a danger to their neighborhood. And I think we really need some more educational program. We need to educate people on, on the experiences of people that are homeless. We need to let people we need to help people understand that this could be them in a few years. This could be their neighbor in a few years. And, this isn't, we seem to have, like, Deborah was saying, this ethos. It's like this belief that it was just a series of one wrong decision after another that leads to homelessness. And that is far from being the case for most of these situations. And so, hopefully education and, ways for people to, to feel more compassion. I'm not quite sure what the answer is for that, but that is a huge barrier for addressing homelessness. And these are the same people that are first to jump and complain that there's a homeless encampment across the street. But then if you propose a homeless shelter, they don't want that either. So it's a really frustrating situation that NAMI's constantly having to push back against.
I think it's constantly believing that people ultimately have better angels in them. And if we can validate some of the concerns in some cases and find a way of bringing people to a point where they feel safe in the conversation, we can see a path. And ultimately, even if we have voices of opposition, we often have stronger voices of support. And how do we lift that support up and give the leaders the confidence to make a decision not based on your next election cycle, but based on your commitment and goals as a city?
I believe there's research actually showing that the bottom line for many of the NIMBYs is property values.
Yeah.
Yes, they talk about individuals, but they also talk about, I'm going to lose, the value of my home. That doesn't happen. The research has shown it doesn't cause a deterioration of property values. So there is some element of this is people won't even listen to the research that's out there. But that's our struggle.
I think another way to help break the stigma is when more people speak up about their own mental health challenges. And I know that that's something that people have been trained to just keep quiet, keep in the dark, don't say anything about it. But the more people speak up and say, hey, I am a person with lived experience, this is something that's affecting my life, but look at me, I'm a contributing member to society, but the reality is, like, most people have experienced some form of mental health issues at some point in their life, but everybody's been trained to stay so quiet about it. We got to break the stigma somehow, and helping break that stigma hopefully will help reduce the NIMBY pushback.
Yeah, I love that, Anna. Thank you. It takes every person to change this work. So this is a question coming from our grant committee specifically. What role does early intervention and or prevention play in addressing the intersection of mental health and housing?
I think it plays a crucial role. You know, one thing that we really promote is social and emotional learning in schools. And so if you start at that, you know, if you start with the youth, then you're going to have less people experiencing mental health crisis when they're older. Most serious mental illness surface by the time people are the age of 25. So if you address those issues early, you teach kids how to manage their emotions, and you know, and you teach them to help really identify, you know, the issues that, you know, the emotional issues that are experiencing. I think that will help lead to less mental health decline when they're older. And again, you know, even as adults, if you have more treatment for, you know, for prevention and early intervention, you're catching those mental health conditions early, you're making sure that people receive their treatment early on before they spiral out, that's going to help. And so when they get in a situation where it's high anxiety, they might lose their job, their rent went up $500 a month, they'll be able to manage their emotions better, and, you know, think of solutions rather than just spiraling into a crisis mode.
Well, you know, they have something, it's called rapid rehousing in some circles, but in New York, we do have a fund, and often it's just a few $1,000s a family needs to stay housed and not to be evicted. A medical bill or, you know, past debts, and that's all it takes to keep them. We also have free legal advice because, you know, when a person's facing a landlord, they're going to have an attorney, and the homeless person or the tenant has nobody. So we're trying to level the playing field a little bit here with attorneys giving advice, because almost invariably the decision of the housing court goes with the landlord because he has an attorney there, well, etc. So there are some short-term things that can be done to where people on the precipice can pull them back from that, especially for families. I would say individuals, it's more complicated.
Thank you. And moving on through to the work of advocacy, Anna, I know that you're working in this area a lot as it is your main role, and patients as well. But I wonder if you can share about the work of advocacy specifically with mental health and housing at the state and local level.
Anna, do you want to kick us off?
Oh, I was hoping you could kick us off.
Well, I can highlight some of the critical advocacy work that's underway, really at the intersection of mental health and affordable housing. We have a couple of bills that are doing that. One, we have the Affordable Homes Act. This is a bill that is in front of the Finance Committee on the House side now. And then we also have a version in the Senate committee. The bill is a revenue bill. It generates new revenue from the real estate transfer tax. So it's actually a tax reduction for people with homes at $525,000 and below. And then it raises the threshold over to $750 in terms of tax thresholds. But it does include a 1% surcharge. And from that surcharge, we're generating about $240,000 annually that's going to be investing in the Housing Trust Fund, which is our mechanism for producing housing across the board, including permanent supportive housing. And then we have a portion of the spend plan that dedicates money to the Apple Health and Homes program. And I'm going to talk a little bit about what the Apple Health and Homes program does. We also invest in people with developmental disability in this bill. So it's really comprehensive. It also does invest in operations, maintenance, and services, which is where we get those wraparound services for people to get support while they're in housing. So critical bill, it needs everybody's support. So if you know anybody who's a legislator for your district, happy to follow up with some links for you to just easily take action. And then the second piece that I want to go to is the Eco Health and Affordable Homes. This is a bill that was passed in 2021. If you are in the weeds, it was Engrossed Substitute Bill 1866. And what the bill does is it really declares housing as a healthcare form. So housing is health. And if people are suffering with any mental illness that is untreated, therefore our way of supporting that is providing housing. So there's a connection and tie to Medicaid and how we use those dollars in housing, and then investing some resources as well from the document recording fee to really invest in a comprehensive healthcare system for people. It also does some capital investments in permanent supportive housing directly. And then there's a tie with the healthcare authority here to provide in-depth services that go further in the spectrum in supporting people for a path to stability. So that's the program that we'll be adding more funding for. It's underway right now. We've got some dollars that have gotten out of the door in supporting housing projects across the board. And then the last bill that I will highlight is the Permanent Supportive Housing Bill that was introduced this year after the vote in the city of Canmore. So it came in really late, but this bill is House Bill 2474. What the bill does is it commits cities to produce housing projects that come up in their community and removes the city as a barrier. So if the housing is prioritizing people with limited incomes and is 100% focused on that, that project should be able to move forward with or without the support of that city. It does facilitate some community engagement that's reasonable, but really it removes some of the barriers that we've seen with jurisdictions being able to just step in and stop the project in that way. So that bill continues to gain momentum and support. It actually got voted out of the House chamber, and I believe it has moved on to the Senate and will need support to get to the finish line. There's so much more that's being advocated for that's at the intersection, but I know Anna is doing great work at the state level, so I want to yield that time over to you.
Thanks, Patience. And I know that you're probably tracking a lot more of the housing bills that we are. So for NAMI Washington, we're primarily tracking the housing bills that have that intersection with behavioral health, which you touched up on. So thank you so much for that. And you know, like I mentioned earlier, there's House Bill 1929, and that is the bill for transitional housing for 18 to 24-year-olds coming out of inpatient care. And as far as you know, mental health specific bills, we are in support of a lot of the bills that supports our 988 crisis system. So Patience mentioned that, you know, that our state is really building on that 988 behavioral health crisis intervention. And last year they passed legislation to allow for these 23-hour behavioral health crisis facilities. And, you know, this is, and then that's when King County after that implemented that tax to fund for up to 5 of these 23-hour behavioral health facilities, one of them being specific for youth. But one of the things that that legislation last year didn't have was the ability to open services for youth. And so Senate Bill 5853 would extend the 23-hour crisis facilities to serve specifically youth. And so it's there's research that strongly suggests that young people need a separate place to be treated from adults. So we can't take adult, you know, 23-hour facilities with adults and put kids in there either. And so we want to make sure that kids have somewhere to go when they're in a behavioral health crisis as well. And then also one of the things that we're experiencing here in our state is we have a severe lack of behavioral health care workers. So we can talk about supportive housing and inpatient care and adding more beds to our state, but we're not going to be able to do any of that if we don't have a workforce to support that. And right now, our workforce, a lot of our workforce, especially when it comes to community behavioral health, they're underpaid. So something that NAMI continues to advocate for is a increase in reimbursement for community healthcare workers, so there could be pay equity there from people that aren't working in community health. Because right now, a lot of people that work in community health are people that newly graduate and are newly licensed. They get a few years of experience at the community health with community behavioral health, and then they move on to private practice because it pays a whole lot more. And so until we can start increasing pay for our behavioral health community workers, we're not going to get people to pursue those professions or get them to stay. So another bill that we're supporting is House Bill 1946, and it's the behavioral health scholarship, behavioral health scholarships under the Washington Health Corps. And so what it is these are conditional scholarships that would be awarded to people pursuing behavioral health professions. And as a requirement of their conditional scholarships, they would be required to work in an underserved community for about 2 to 3 years, depending on the size of the scholarship. And that bill is actually also moving through the Senate right now, and we're hoping to see it get to the governor's desk. So when it comes to state advocacy and even local advocacy, what we really need are people speaking up. Especially when it comes to local advocacy, this is really when when the communities, the NIMBYs come out, and they're really loud talking about not wanting these facilities. And if those are the only voices that your local leaders are hearing from, they're going to do what they say. What we need are people that are willing to stand up and say, I am happy to have supportive housing in my community. I am happy to have low-income housing in my community. We don't have enough voices speaking up for that. And so we need everyday people saying, yes, please bring these to my communities. And that's what we really need to see on a local and state level.
Feel like I just want to write down everything you're saying because it's so good. So thank you for that encouragement. And I think we all can do our work of advocacy more holistically. So it's a very good encouragement. I would love to end our formal question period by asking one of my favorite questions, which is what is an additional resource, book, podcast that the audience can take for further learning on this subject. And then I will open it up for questions from the audience. Oh, Deborah, you're muted.
Oh, I forgot. I was going to shamelessly plug the book, Housing First. Oh, it's in blurry. I don't know how to deal with that. Anyway, I wrote the book with the intention, hopefully, of providing, a way to advocate through evidence. And I still believe in that. I'm involved with the National Alliance to End Homelessness. And we're doing research and, as things on the Hill, planning advocacy events. And right now under Biden, we've got some people, Jeff Olivet at the consortium and Anna Leva at National Alliance. So, I mean, there's some really good people in place. And I think the current administration is more thinking along these lines as infrastructure and housing is needed. So I'll stop there. Sorry. Do we go another half hour? I'm sorry, I didn't realize the timing on this. We do, okay.
Yeah, about 10 to 15 more minutes.
The only thing I can add to this right now, because a lot of my research I do just through Google, and then I find the best sources that I can find. And so, but one thing I'd like to encourage is if you're interested in advocating for mental health, I'm going to put a link to join our Action Alert listserv. And so you would get updates on bills moving through the House and the Senate, and also Action Alert. So when a bill is stuck in a committee and we need people to ask their legislator to move it forward, you'll get an email for an Action Alert. A lot of times you just click on a link. It's a pre-written letter. You just sign your name to it, hit send, and it goes straight to your legislator. So I'm going to go find that right now and put that link on the chat.
Similar to that, I will make 2 shameless plugs, which is one, I'm including our state legislative tracker with affordable housing relevant bills that we track. It also tells you where the bill is the bill dead? Is it moving forward? Does it need action now? And if you sign up for our action alerts, we also send those pre-made and ready for you to take action. The second book that I'll put a plug for is the book by Greg Colburn. I'm sure many of you have had him speak or seen him at some events. Housing is a homelessness problem. And what they really do with his co-author is they look at the substantial variation of homelessness across the nation, and then they test some beliefs that people have on homelessness, whether that is mental illness, drug use, etc. And they conclude that at the core, our housing market is what impacts the rates of homelessness across the board. We do not have enough housing for people, to the point that Deborah raised earlier on this being a game of musical chairs. They really go into that analogy in detail on how our market is playing up against people based on their economic position across the board, their socioeconomic determinants across the board in accessing housing. So we will have Greg Colburn as a speaker at our annual celebration right here in King County on April 17th. Please save the date, register. We would love to see you there.
There are a couple of cities that have done really well, Milwaukee being one of them, and Houston. A lot can be learned. And I know that Milwaukee just got all the stakeholders together, and they've reduced their street homeless. I think the last part in town count was 17 people.
Yep. And keep playing that zoning.
Yeah, I mean,
not have any zoning.
Right. They have they have things together. Houston as well. So I think there's a lot of cities that can learn from the experience of the Milwaukeeans.
Well, excited for those continued opportunities to learn. I wonder if there are any questions from the audience for our wonderful panelists. And if there are not, that is totally okay. But this is a great opportunity to ask these very experienced and knowledgeable folks about this issue. So maybe we'll give it one more minute. And maybe it's been a very thorough learning. So maybe we don't have any more questions. Aru, I see you.
I actually have a very basic question. Right in the beginning, Anna, you differentiated between supportive housing for those with mental health and affordable housing for all. So when we are looking at mental health and housing, we are essentially looking at supportive housing, isn't it? So my question is then, for patients like HDC, does it, who deals with supportive housing in our state? I mean, we have things like Plymouth Housing. Does HDC also do both affordable and supportive?
Yes. So we do the full spectrum. We have the members like the Downtown Emergency Services Organization, DESC. They produce permanent supportive housing. So that's the housing with the wraparound services. We have organizations like Plymouth Housing who do that kind of work as well across the board. And then we have Chief Seattle Club as another organization that does permanent supportive housing. And then you have the Catholic Community Services group that also develops permanent supportive housing. So we have a number of housing providers whose sole focus is really how can we scale the production of permanent supportive housing across the board. What they come up against is the limited resources to scale their projects, but they've been at this for the longest time, and they've been able to triage and use the resources that exist to really produce high quality housing across the board. Great question, Aru.
Thank you, Patience, and thank you, Aru. Christine, I see your hand up.
So my question is, so Milwaukee is being held up as, this is the way to do it. Wasn't Salt Lake City held up as this was the way to do it several years ago? Like how, is it like this is the way to do it and then they get overwhelmed with homeless people coming and it doesn't support it, or the funding stops after 5 years? So like from Milwaukee, how long have they, like, we've got it all figured out? How long has that been going on? And that's what I always think is, like, if there was one answer of like, this is how you do it, no matter the cost, every city would do it, right? I mean, and so that's why it's like Milwaukee is special, but is Milwaukee special for now? And when word gets out that, hey, Milwaukee will give you housing and food, and this, are they going to get overwhelmed by people around the country coming in going, yes, that's what I want? Because I keep hearing like this city, this city, this city, but why, what's the answer that these cities have, and why can't we do it in Washington State or Seattle?
Well, with Milwaukee, they just literally got everyone on board. The police department, the parks department, the public defender, they actually forgave all of those minor offenses that prevent many homeless people because their credit rating is bad or they have fines, criminal records. So they erased those minor types of crimes so they could find housing. So, and Salt Lake City, yes, I mean, they had an all hands on board several years ago. What happened is they kind of lost their way and decided to go more shelters and put less emphasis. I hear you. I think time will tell. But I think as long as places like Milwaukee are willing to keep doing what they're doing, I can't imagine it not working anymore. It's working as it is.
So I wanted to add to that, we had talked earlier about how this is a multifaceted issue. So, it's all, I think a lot of it is addressing the social determinants of health. Do we have living wages? If people don't have living wages, they can't afford housing. Even if you have affordable housing, if they're living on minimum wage, they still can't afford housing. And do people have food in their bellies? Do they have health care? And so I think part of the issue is looking at this as looking for a silver bullet to fix the issue, which we don't have one. We need support when it comes to employment, living wages, lower food prices. And so I think as long as those issues aren't addressed, this is going to continue to be a spiraling problem. Somebody had asked about, what percentage of money would you direct to prevention and intervention and what to direct services? Well, I can tell you right now, prevention and early intervention is a lot less expensive than direct services for people that have already, spiraled into crisis, or, people that have serious mental illnesses that was spent years not being addressed. So I would say that more money would have to be spent towards direct services because, again, those services are more costly, and early intervention and prevention will help save the state a lot of money and ultimately.
Yeah, I would echo that. I mean, there is no silver bullet that can address this crisis. It's a complex, wicked issue. And I think the through line with Newark has been the deep collaboration that has occurred.
Yeah.
at all levels of government, right? You have the county, you have the state, you have the cities really coming together with this different other 100 partners plus on a comprehensive plan. It's not one thing that gets done and then voila, we're here. Because we can talk so much about funding, but funding alone won't address the issue. How comprehensive is the use of the resources once they are there in looking at services that people need, the kind of housing they need, and then in producing that housing, what are the innovative strategies that we can lean on? They've even used containers as part of their strategy. And yet here, that kind of innovation, we're still lagging a little bit behind as Washington State in really embracing new alternative ways of how we produce housing across the board.
Thank you. Thank you. Those are great questions. Glad those were brought to our attention. I think that we may be done unless there are any other questions for these wonderful panelists. Anna, you touched on the question in the chat, which is great. So please join me in giving thanks to our panelists for their wonderful, wonderful thoughts and experience that they shared with us today. We'll take this learning and hopefully help make the world a bit more equitable in this arena. That is it. Thank you so much for spending time with us today, and have a wonderful day.
Thank you. I think Aru still had a point to raise.
Oh,
It
so
wasn't
sorry,
the
Aru.
point. No, because we were talking of advocacy, and I realized advocacy can be done really at a very local level. Anna spoke about the voices, all voices not being heard. Well, I live in Redmond, and the next city council meeting will be very lively because there's plenty of NIMBYs who will come out, and you realize the city council needs to hear the other voices too. You can't just sit at home and say, I'm all for it. No, I think we have to go there. So Anna, thank you very much for, for that. It matters. It matters to have the voices heard at even our local level.
Can I just add to that? Just also just want to remind people that we have about 3 weeks, well, 2.5 weeks left, probably less than 2.5 weeks left for our legislative session. It ends in March 7th, but we are nearing the last fiscal cutoff for bills. And so for the bills that are still alive, the ones that Patience mentioned, and the bills that I mentioned, we really need a push for people to write their legislators to support this legislation, because right now we're really at the tipping point where a lot of bills die. And so if we don't have people advocating for these bills, they're not going to go anywhere. So advocating on a state level right now is extremely crucial.
Thanks so much for adding that, Anna. And yes, thank you again all for being here. We will send out an email with the recording and with resources and advocacy actions. Thank you again to our panelists.